but you guys obviously just modeled the impact of lowering Medicare to age 60. First, what did the analysis find? And second, what should we expect? Should we expect this proposal to reemerge in the future?
Well, let me start, and I'll just give you the top line numbers. What we modeled two scenarios there, and I'll let Steve talk a little bit about those scenarios because it's an interesting example of how you have to make assumptions. But basically, we modeled a floor and a ceiling, like what's the least this could cost and what's the most this could cost. And so we found it was roughly $380 billion over 10 years was sort of the low end, and then 1.8 trillion as the high end. In both scenarios, though, you increase the number of insured by about 3.9 million. So that cost difference is really more about moving people around between different kinds of coverage. And Steve could talk a little bit about the assumptions we made to get those two scenarios.
Yeah, so the first model that we did that was much less money was basically just saying, what's the average cost for someone who's in that age range to be sort of covered, given that there's some discounting that goes on with the Medicare program being a little more administrative efficient in terms of how they want to do it. And that's pretty much where we got the number. We basically figured out how many people that are uninsured that are in that age category using data from census and just speculated out from what we already know from the spend of the model. The other exercise, as Chris said, the assumptions matter, was that we assumed that essentially employers basically that have people of that age essentially drop, that they totally get out of the market
in the high end, in the high end scenario.
Yeah. So in the high end, when it's like the over the trillion plus scenario, as we call it. So basically, in that scenario, the thought is a lot of employers, because these are the most expensive employees potentially, right? Because of just the age rating and how they actually come back to that plan. And granted, a lot of them they're community rated, meaning that they're all the employees are paying the same premium, but the actual spend for those people to an employer is quite different compared to someone younger, right? So if they have the option to just drop them all, and so this is actually something where we argued internally, Chris and Doug and I, sort of like, well, how are we going to model this? It'd be 50%, 70%, 80%, and Doug's an economist at heart. There's a part of me that's the same way. And we're sort of like corner solutions. So it's like either they're all in or they're not. So the thought is like, what if we assume there's no erosion and that's the cheap number? And what if we assume all the employers for that age bracket just go, we're out? And that's what pushes this to $1 trillion.
$1.8 trillion.
Yeah. Just for basically ensuring the same number of people. And so that's, I mean, if anything, what I like about that analysis is it underscores how fragile this is. Like you talk about so many times in health policy, you have like these tales of unintended consequences, right? And so you're trying to do this because it's a vulnerable population at 60. You just want to help them out. Maybe their job losses and things as they're getting older in life, but yet suddenly there's like this totally unintended consequence for major corporations just wholesale dump people and create a much more expensive program for the feds and us as taxpayers.